My name is Dr. Mark Lewis. I'm the Director of Gastrointestinal Oncology at Intermountain Healthcare in Salt Lake City, Utah. I treat cancers of the gut, which includes the liver. So mental health is an essential part of wellness, and for far too long, and I'll admit, even in my own medical training, the focus was almost exclusively on the physical body. But I am a huge believer in the connection between the mind and our physical self. You wouldn't run hardware without good software, and our mental health is really the software that runs our body. So I have seen patients diagnosed with liver disease or liver cancer really sort of withdraw into themselves, become angry both at the world and at themselves. And I think one thing that's under-recognized is how much people sort of back away from support when in fact they need it the most. I treat many patients with liver disease, and I see them blame themselves too much, meaning that not all of us can control what happens, especially in terms of cancer. Because liver cancer is linked to certain causes, like viral hepatitis or alcohol use, it has been needlessly stigmatized. We saw the same thing happen with lung cancer and smoking. Absolutely no one deserves cancer, nor should they blame themselves for a cancer diagnosis. A lot of liver cancer arises for reasons that we have no control over. And that means that when patients are diagnosed, they don't need to spend so much time blaming themselves. They really need to focus on their own health and allow themselves to improve. There is so much stress associated with a cancer diagnosis. When people come to my clinic initially, their blood pressure is up, their pulse is racing, and I can tell they have a flight or fight response. And that fear sometimes doesn't go away, and people remain apprehensive and anxious on top of the physical complaints that they have to deal with. When patients first meet me, their biggest stress is prognosis. And we walk a fine line in oncology these days between hope and hype. What I mean by that is we don't want to overpromise and under-deliver. On the other hand, the future has never been brighter for patients with liver cancer. There's a variety of appointments that happen in an oncology practice. Some of them are associated with more anxiety than others. So this term scanxiety means the apprehension around imaging. What are they going to see inside of me? My body's a black box. What does it look like inside? And so I am aware that not all appointments are created equal. Some of them are going to provoke more anxiety in my patients than others, and I try to make sure that one of our social workers or mental health professionals is around as a resource should they be needed. One of the terms that I use in my practice for loved ones around the patient is co-survivors. We are all in this together, and the best case scenario is that a family unit or a friend group unites around the patient. I have learned specifically in the last several years just what vital therapeutic allies these people can be, meaning that while I have the patient in my office, I can take care of them. But let's be honest, the vast majority of the time, they're being cared for by their family and friends. And I think it is really important to acknowledge them, to address them. And if they need help from, say, social work or mental health, we should engage resources for them too. I think it's under-recognized just what stress and strain a cancer diagnosis puts on a relationship, like, say, a marriage. And of course, this is outside the realm of just the cancer treatment. I want patients and their loved ones to know it's okay to bring up these concerns with your oncologist, to ask if there are additional resources that they can use. Social workers, again, are experts. This is literally their field at assessing these kind of family dynamics, helping with monetary concerns, and trying to keep marriages intact so they're not ruptured by a cancer diagnosis. I try to make it a practice when I meet a patient to inventory both their physical and their mental health, just as a matter of practice. And I find by that building it into a routine, it lets them know, hey, this is nothing to be ashamed of. This is part of coming to the doctor. If I know a patient is struggling, I try to check in on them between in-office visits. And we have ways of sort of setting reminders that if someone is more distressed than we might expect, they need those check-in appointments to make sure they're okay between the physical visits. So this sort of distress scale and measurement is really a modern way of making sure that someone's health remains steady and stable, even between their office visits. My feeling is that over time, I actually get to cultivate what I call a therapeutic relationship with a patient. The first visit, of course, is going to be extremely anxiety-provoking for most people. But over time, just like any other relationship, you develop a sense of trust and partnership. And that's earned. That has to be earned again and again. I have to be very honest with the outcomes that I expect, and then help patients who respond to treatment one way or the other. And I find that by doing that, almost regardless of the outcome, we end up with a trusting and meaningful relationship. I think one of the challenges of being a patient today is realizing that your care is going to be multidisciplinary. It is rarely the case that one person can take care of all of your needs. It doesn't mean that we think any less of you if we engage other professionals in your care. Cancer care is a team sport. I literally cannot take care of patients without the help of multiple other professionals, including nurses, social workers, and what we call supportive care. One of the things that's been really wonderful over the last several years in particular is the rise of support groups, both in person and virtual, that can support patients and their families. One of my key messages is that no one does this alone. In the modern world, the connectivity that we have allows us to find people in similar situations. No one is exactly the same, but finding a like-minded person who has been through this can help you realize, hey, this is doable. This is something I can achieve. One of the axioms I like to follow is get 1% better every day. And it's almost like compound interest. By making a small change that you can commit to daily, you'll see that add up into big progress over time. One example I would give is exercise. You need to find something that really works for you. It has to push you a little bit, but not too far. And if you find that sort of sweet spot, you'll find that you like exercise, that you get the endorphins and you get the positive feedback, and then you can stay on the program. Bodies in motion stay in motion in every sense of the word. So it's not just a physical benefit, it's a mental reward. There are literally feedback loops in the brain, transmitters and chemicals that are boosted by exercise that make you feel good. One of the things I want caregivers in particular to know is it's not selfish to take care of yourself. If you don't take care of yourself, you're not going to be able to then take care of your loved one when they really need you. So no one needs to feel ashamed for focusing on themselves. And to be honest with you, it took years for me to learn this lesson myself. Deep breathing, meditation, yoga, and exercise are all great ways that people can sort of refresh, rejuvenate, and then present the best version of themselves to their loved one in their time of need.